Good evening. This is Vernon Maniago. I'm here presenting my Nursing 642 Week 7 signature assignment on psychotherapy treatment. And here's the scenario. Antoinette, or Tony, is a 28-year-old Asian female who came in for psychotherapy referred by her primary care provider. She was initially seen about a month ago as a new patient considering getting help with her gambling problem and is now considering seeking treatments with this psychiatric nurse practitioner student working alongside the clinic licensed social worker. She has deferred pharmacological treatments. She has been having problems with her social life and fiance and has been having difficulty concentrating lately at work as an IT specialist. She reports she has been gambling heavily for the past 6 months. Both her parents passed away from a tragic car accident almost 2 years ago. She has been selling some of her personal things lately on the internet and has been going to her favorite local casino more often in the past 6 months. Tony has been restless and irritable when trying to cut down on her gambling and feels she needs to catch up with her losses to save for her wedding. Her fiance, John, has been worried about her gambling habits, and although he is supportive, he has signified postponing the marriage if she did not seek help. Thus, she is seeking individual therapy because she's currently too ashamed to talk to him about the extent of her gambling problem. The research I saw, research has consistently shown that Asian Americans are less likely to seek help for their mental health problems than other racial demographic groups and less than their representation in the US population. Social stigma, shame, and saving face often prevent Asians from seeking behavioral health care, particularly when experiencing significant gambling problems. Studies have shown that fostering a non-judgmental, empathetic, self-empowerment, and client-focused psychotherapy care can reduce stigma and implement compliance with psychotherapy by implementing known treatments such as cognitive behavioral therapy, or CBT, yoga, and mindfulness techniques, which has roots in Buddhism and Asian traditions. Thus, the Asian American community can benefit from humanistic, patient-centered, and cognitive behavioral therapies that places more emphasis on education, empowerment, and self-improvement. The therapeutic modalities planned for Tony include number 1, motivational interviewing, number 2, humanistic solution-focused therapy, number 3, CBT. Motivational interviewing, or MI, is a brief, client-centered method to assist clients in making positive changes in their lives. MI interventions are tailored to the person's stage of change, and evidence shows that they are helpful with individuals from different cultural backgrounds and socioeconomic levels. The goal is to understand the patient's ambivalence by implementing empathy and supporting self-efficacy. Tony has expressed and contemplated seeking therapy and is worried she might lose her fiance and her career. To start, this therapy can assist Tony to tip the balance in the direction of developing a plan for change while strengthening her self-efficacy. The next therapy that will be incorporated is the SFT. As Tony moves towards the preparation phase of therapy, SFT maintains an attitude of respect, empathy, and affirmation, while emphasizing on future plans rather than past difficulties. By shifting the focus away from Tony's past problems towards possible solution moving forward, she can begin to view options and construct present and future solutions. And finally, we will include CBT, which is considered the most efficient method for treatment for gambling disorder. CBT aims to reframe her distorted thoughts of trying to win back her losses and increase stress by changing how she thinks, feels, and behaves, and how to combine the positives of having a partner in life, starting family, and having a strong career. I have chosen this order based on Tony's current view of expressing she has a gambling problem and her need to seek help, as she already made efforts in coming in to see a therapist. As the counselor, it is important to be part of the client's team and to promote a non-judgment alliance in support of their goals by allowing the change to occur by encouraging the client to take ownership in moving forward toward a solution. Then, CBT trims will reinforce positive thinking to prevent relapse and sustain the change by encouraging homework, journaling, and healthy coping strategies like exercise, mindfulness thinking, breathing, relaxation, and guided imagery. So I'm going to start with motivational interviewing. I'm going to bring Antoinette or Tony. Good morning. How are you?
I'm good.
Hello, Antoinette. Thank you for coming in to see me today. Before we start, do you understand and give a consent for this session to be video and audio tape and be submitted to UMass Global?
Yes.
So I spoke with you during your last visit about wanting to initiate some helpful modalities with trying to stop gambling after being referred by your primary care provider. I would like to ask you some questions to assess your motivation for change using motivation interviewing. You were pre-contemplating during our last visit, so before we start, I would like to thank you again for coming in for continued therapy sessions.
Thank you, no problem.
How are you doing with your gambling?
Well, I know I have been trying to cut down on my gambling, and so far, I have gradually reduced my wagering and losses to a manageable level, but I'm getting behind on my bills and I'm becoming distant with my fiancé, but we are still trying to working it out.
You mentioned in your intake assessment form that you gamble to get away from personal problems to try to escape from your stress and sadness, and that gambling gives you some sort of relief and elation.
Yes, somehow I have been managing my gambling since I was 18 years old, but after my parents died about 2 years ago, I feel that gambling has been my respite from all the drama and stress I have experienced, especially in the past 6 months since getting engaged.
I understand. So, do you find life becoming more stressful and that going to the casino after work makes you feel more relaxed?
Yes, I feel like it is my happy spot, especially when I win a lot of money.
What do you see are the downsides of gambling at this stage in your life?
Well, I know I must focus on my career and work, on my relationship, and if I keep gambling and losing more money than I win, I might lose my job and maybe my fiancé, and maybe everything. I am just sad that my parents will not be there when I do get married.
I can see that this is somewhat bothering you as well.
Yes, now that you put it that way, I have been pretty hard on myself since my parents' passing.
I see that you mentioned your fiance is supportive. Have you shared your gambling concerns with him?
Yes, he noticed I have been spending more on gambling, especially when selling some of my clothes and shoes that I don't need to use for gambling. He is supportive and I realize that, so I am now willing to get some help.
Great. I encourage you to speak with John and be more open with him, and perhaps you'll feel less stressed about your future together and that you may continue to cut down on your gambling. I'd like to hear about it on our next visit, okay?
Yes, thank you.
Thank you. Have a good day. So Antoinette comes back in a month later and we'll implement solution focused therapy or SFT. Hello, Antoinette. Thank you for coming in to see me today. Before we start, do you understand and give consent for these sessions to be video and audio tape and be submitted to UMass Global?
Yes, of course.
Hi, Tony. How are you?
I'm doing good, thank you.
I know you wanted to seek individual therapy, but have you spoken to John about your gambling addiction?
Yes, I have spoke to him and he continues to support me.
That's great to hear. I'd like to incorporate solution focused therapy or SFT, which emphasizes future plans rather than past difficulties, like MI. The basic theory of SFT is that by shifting focus away from client's problem and towards a possible solution, you will begin to view life through a new lens of possibility than impossibility. Imagine that you went to bed last night, and while you were sleeping, a miracle occurred, and when you woke up, the problem was removed and your gambling issues were all addressed, how would you know? What would be different?
Well, I would not have a gambling addiction. I would work things out with John and get married. I would move on and have a family as I know that is what my parents would want me to have and to be happy and healthy.
What would you need to do what would you need to do for this to happen?
I will need to refocus on my relationship with John and my career. I will greatly reduce my gambling habits and ultimately stop altogether. I will exercise more and do things with John like hiking and traveling like we used to do when we were dating.
I'm sensing your goals and your desired future. Would you be willing to learn more solutions and techniques towards those goals and sustaining it?
Yes, please. I would love that.
Okay, well, I'll see you in our next visit, okay? Thank you for
Yes.
coming.
Thank you.
So the last modality I will be using is the cognitive behavioral therapy, or CBT. Hello, Antoinette. Thank you for coming back. Thank you again for coming to see me. Before we start, do you understand and give consent for this session to be video and audio taped and be submitted to UMass Global?
Yes.
So, Tony, in our previous session, we collaborated together to come up with an ideal future for your desired goals of stopping gambling addiction, getting married, and starting a family. In addition to MI and SFT, cognitive behavioral therapy is designed to formulate techniques for you that are brief and goal oriented by focusing on how you think, how you feel, and how you behave. The goals of CBT are to recognize distorted and irrational thoughts and replacing them with more realistic and positive ones. In addition, CBT involves homework activities that bring you a sense of accomplishment and pleasure, thus improving your mood and motivation. So today, as opposed to our previous sessions wherein I assessed your motivation level and allowed you to recognize your strengths and desired goals at the present and future levels, I want to talk about the CBT to improve your skills and ultimately reaching your goals. Is that okay?
Yes, and thank you for telling me about CBT. I was reading about that last month and started to do positive self-talk by saying, I am calm, John. I am calm. John loves me and I can do this. Each time I feel stressed, anxious, or depressed. And when I'm stressed at work, I do the 3-minute breathing exercises from YouTube to relax and stay focused on the present moment.
That's awesome. Those are positive parts of how CBT works by engaging and incorporating a sense of positive reinforcements to continue to sustain change through mindfulness-based cognitive therapy or MBCT approach. You encountered a negative stressor or urge, you realize it and replace it with positive thoughts, which affected your emotion and behavior in positive ways. Also, I request for you to start writing your thoughts in a journal, and each time you feel you want to gamble or when you are stressed, by recording your unproductive thoughts and replacing them with positive thoughts that you can read often. This can help you manage your emotions and to reinforce your positive coping skills. Exercising or simply walking 15 to 20 minutes a day can help you clear your thoughts as well and improve your well-being.
Oh yes, John and I started to walk after the sunset at least 3 times a week, and he listens to my feelings and thoughts, and we have been working it out for the better. We are actually getting married next month at the drive-through chapel in downtown, and I am more than happy that his family has been supportive. And I remind myself every day that even though I lost both my parents, I have gained another, and that makes me happy.
That's great, Tony. That's great. Thank you for sharing your feelings and thoughts, and I'll see you next time on our next CBT session. Goodbye.
Yes, thank you as well. Goodbye.
Thank you. So in closing summary, I incorporated the 3 therapies in this scenario as it provided a brief solution that is goal-oriented, collaborative, and client-centered. Studies have shown that combining MI and with CBT may lead to greater improvement in a long-term outcome while reducing the stigma and allowing and encouraging this ethnic group to take ownership of their role in the problem as the expert in their lives. Starting with MI, I was able to gauge Tony's level of motivation in stopping the gambling problem that has started to cause concerns with her relationship and work. And then by knowing that losing her parents may have contributed to her downward spiral, I wanted to include SFT by focusing on her strength of having a career and supportive fiance while integrating CBT solutions. CBT also helps her brain to learn to react intellectually instead of based on negative feelings or impulses, to think positively and to become more aware of other things that she can do instead of gambling. The three therapies complemented one another and helped her gain self-efficacy by bringing out and enhancing her motivation to modify her negative behavior using CBT approaches, which are essential to feeling better. I've used American Psychiatric Association Diagnostic DSM 5th edition TR for my reference, including I also use Wheeler Psychotherapy for the Advanced Practice Psychiatric Nurse, 3rd edition. Okay, that will conclude my 3 sessions and my assignment project. Thank you so much. Have a good day.
Recording stopped.